Everyone, and thank you for joining us today, Thursday, April 30th. I'm Kylie Peck from the Greater Watertown North Country Chamber of Commerce, and as part of our Coffee Talk series, today we will hear from Scott Gray, Chairman of the Jefferson County Board of Legislators. As our region anxiously awaits the reopening of our economy, today we'll learn about the impacts the COVID-19 pandemic has had on our community and the necessary planning and preparations that will be needed to move forward as we know what that guidance is as of today. As a reminder to everyone, our Thursday Coffee Talks are recorded and shared on our website and social media. So please visit our website at watertownny.com for past recorded sessions and other helpful resources. And just a reminder, once Scott has presented, we will open up the floor for questions through our chat feature, which I'll read out loud, and Scott will certainly answer to the best of his ability.
Sorry.
So with that, I'd like to welcome Chairman Scott Gray. Good morning, Scott.
Good morning, Kylie. How are you?
I'm doing well, thanks.
Pleasure to be with you today, and thank you for the invitation. Pleasure to be with all the chamber members. Certainly is good to see everybody. Hopefully everybody's doing well, and anxiously awaiting that we get the green light, and for sure that it is not for sure that we're going to be opening yet in a couple of weeks, but we believe we're in the front running to be allowed to move forward. So yeah, so it's a pleasure to be with everybody, and I hope we get this economy up and running shortly.
Sure. So are you going to go ahead and just give us an update on where we are today and what that looks like moving forward?
Yeah. So first of all, before I start anything, I appropriately like to acknowledge the work of our public health department. They have got us from whatever the date in March was. What was it? Around March 20th, I think we closed down, somewhere in there, to the point today that we're at, a little over a month. And they have managed the healthcare situation in our community very well. We started out with certain measures that were, isolate and do test and isolate and social distancing. And so we started off with a lot of measures by the state that we started to execute, and our health department has done an absolutely terrific job. Largely, the low numbers that you see on a daily basis are in fact due to the work that they are performing. A lot of it is when we have a positive, the health department has to, first of all, we don't wait for it to be uploaded to the state system. We're in contact with the labs every day, and we have to then we have to notify all the contacts of the positive. And that is what is done, is slowed the spread down. And you'll see that our numbers, there we go, my dogs. Our numbers are crawling versus some other counties that you've seen around us, where they're going up by, in some cases double digits. So ours have gone up by 1 or 2 a day. So they've really done a great job. They've been working very hard. Their our prevent staff and our contact abilities for the immediate contacts of the positive have been tremendous. And we've isolated people and quarantined people. And that brings us to where we are today. They have essentially positioned us to be in the forefront to open our region first. You've heard the governor talk that Central New York and the North Country are certainly positioned to open first. And so we hope that that is going to be the case. We have not heard anything definitive. I'd hope to have more information by today, but we're still kind of going by the rough parameters that the governor has outlined. So as you are well aware, Kylie, of the North Country Regional Economic Development Council, that is the coalition that that will move us forward. So I have been working with the chairman in each one of those, and let's define what that region is. That is Clinton County to the east of us. It is Essex County, Lake Placid area. Then it goes Franklin, St. Lawrence, uh, Jefferson, Lewis, and Hamilton. So so it's a large area in terms of mass. It right over the top of New York State, and it's kind of a U shape. And so we're just kind of working together. We had a call earlier this week with these 7 chairmen for the county regions for the region, and to discuss how we're going to move forward, because our success and our opening depends on everybody else. We're tied to everybody else in the region, and we have to. Our public health department has different boundaries. They work in the I-81 corridor. So for our public health department, this is kind of a large shift for them. And actually, our public health department has already reached out to the other counties in the 7-county region, and they have tomorrow scheduled a Zoom meeting with all the public health directors. So, because our continued success, first of all, getting to the initial phase in 2 weeks is dependent upon them, and every 2-week interval is going to be measured against a healthcare metrics. So we have to. Not quite sure exactly what all that means right now, but we know that our R0 rate is going to be, which is the rate of transmission, that is going to be a heavily influenced factor moving forward as we get to each 2-week interval to open up a little bit more of the economy. Excuse me. So that's kind of where we're at right now. We are hoping that we're going to be at the we're going to meet the May 15th deadline. We are still waiting. Tystone was put on an advisory group, and that is more of the reimagining New York that the governor has been talking about. That is more an advisory group that's going to reimagine and is going to look at how the delivery of medicine is, medical delivery, reimagining teleeducation, and even I assume they're probably going to touch upon reimagining how local governments deliver services. So that's going to be an advisory panel that's going to kind of reimagine New York. The reopening process is a different process, and we're still waiting. I think you saw the lieutenant, probably most of you may have heard, Lieutenant Governor has been appointed the lead person for the reopening in Western New York. Bob Duffy, who's the former lieutenant governor, has been appointed for the Finger Lakes area. And so we're still waiting for the Central New York appointment and the Northern New York appointment. So, and then we start the process. And that process is, so phase 1, let me back up to say, before the governor announced it was going to be regional economic development councils, probably 2 weeks ago now, I advanced a rough plan to the governor's staff that I'm on the phone with them every day. About 4 o'clock we call, and then interim we have calls, we talk. But I advanced out a plan. This is before any talk of reopening was happening. That I thought we were uniquely positioned to go first, so to speak, to do a pilot program that would open up our economy. And I was even willing to reach out to Lewis County, and we reach out at that time. I was thinking about reaching out to Oswego because they had similar numbers and they had a similar infection rate. We were all around 4%, somewhere in there, and or 4% out of I forgot what the number was, 10,000 at that point. So so we had offered to put that, I'd offered to put that coalition together as a go first pilot that would test what the reopening would look like and where all the drawbacks would be and where all the concerns would be. At that point, I offered that I think we should open construction. All outdoor construction should be open. All construction companies should be operating, especially if they're doing outdoor work. And if they're doing indoor work, then it should be limited to a couple of people. And all outdoor venues should be open. Golfing should be fully opened. Boating and marinas, so there's fishing, recreational boating, all of that should be basically essentially open up our waterfronts, and which is a very common area between us and Oswego. So, and at that point, I even offered restaurants. I thought restaurants were a mechanism for a number of different things. One, we'd get people out. A lot of people are pent up and ready to move and do something. So we would get restaurants open with a very limited capacity, especially the ones that are already doing takeouts. If we could get them open at a limited capacity, we could get people acclimated to operating in the new environment that's going to be in front of us. And then we could, when we could see how that would go in terms of, and it would be easier to monitor. And then I also thought retailers, small businesses, perhaps 10 or fewer employees would be easier to open, and would be certainly a lot of the small businesses, a lot of the employees or owners, let me say that, a lot of the owners haven't been able to get the unemployment benefits that some of the employees out there in manufacturing and other sectors have been able to get. So their salaries or their livelihoods are tied to their businesses operating. So I thought it would be important if we got private sector businesses open first. So it wasn't 24 hours later, the governor announced his reopening plans. So I immediately texted one of his staff members. I said, okay, you can draw back my plan. It's off the table. He's got his own idea. And it did include construction. His includes manufacturing. And we're still, the 7 chairs of the county region are still debating that. Ultimately, we have to do what we have to do to get things open. But we're still discussing that amongst ourselves. I will tell you that, automobile dealerships is another one I think we should get open. But I will tell you that, everybody believes in that region, believes that restaurants of some limited capacity should be reopened, and retailers, they're of the same mindset. Now, if the governor says it's construction and it's manufacturing, that's what we'll do. It is easier, and there are probably fewer instances that we're going to run into for potential problems if we open up smaller businesses first versus manufacturing in large settings. We open up large settings where it is kind of it is a large leap in the first phase, to see if we can monitor that and to see if there's no problems with that. But obviously that entails congregating a lot more people than smaller businesses do. So right now, phase 2 is the business sector that's going to be open, and unfortunately, the governor is using the term attractive nuisances, and and he's referred to the state fair. So you can draw conclusions. You can go from the state fair and you can go back. And unfortunately, when you talk about attractive nuisances, there are potential problems for our tourist season under that context. So we're watching and we're paying attention very closely. Two other counties, let me just tell you, 2 other counties, Essex and Hamilton, are wholly contained in the Adirondack Park, right? So they are, by their nature, and Bill Farber from Hamilton County said he was happy to be upgraded from a terrible nuisance to an attractive nuisance. So, but they are essentially, that's what they are. They're attractions. You know, a lot of those, you know, the Lake Placid area, they're just attractions for people. So we're watching that. We're going to push back on that, and we're going to try to push the agenda that best fits the 7-county region. We're going to keep pushing that forward. And I suspect that Albany will keep pushing back at us, but that's what we do. That's what we're supposed to do. And ultimately, you know, we will do what Albany says we have to do in order to get our economy back open. So one of the things I would tell, so we're tied, this whole process is going in 2-week intervals, and we are tied to both our healthcare system, and that is hospitals in the region, Samaritan Medical Center, Carthagena Hospital, River Hospital, Claxton Hepburn Hospital, any of the hospitals, Adirondack, any of the hospitals in the region, we're going to be tied to a metrics relating back to them. And so we're going to have to bring them into the process. And there's a capacity level for acute care beds. There's a capacity level for ICU beds that all have to be monitored through this process. And my dog is going to, it's one of my puppies, going to bother me right now. So, and as well, the public health departments are all going to have to be involved, and we're going to have a certain set of metrics that are going to that it's going to be measured there. So as I explained it to the chairs of each one of the counties, you know, we have 7 gears that are all going to be turning, and we all have to be turning at the same speed. You know, and 7 gears represent each one of the counties. And then each county is going to be a subset, and they're going to have their own gears turning. We're going to have an economic gear turning. We're going to have a healthcare gear turning, and the county operations turning. So, because the county operations are going to be what turns out the rest of this and makes the rest of this all work. So it is, you know, somebody said the other day, said I thought I was exaggerating when I said this will be monumental. And let me just put it in context. This is building a system, designing a system, so to speak, and building it from ground up that is going to take us through probably well into the fall before we are, even if somebody asked me, if I said if we were back at 75% by the fall, we would be doing well. You know, hopefully maybe by the end of the year, we'd be close to 100% fully operational. And so it's going to be a long process. And, you know, we're susceptible to setbacks. We're susceptible to pauses, you know, or drawbacks. And, you know, a couple of our counties were, you know, Hamilton was thinking about going over to the, you know, associating with the Oneida region. You know, some were thinking of, and we don't want to split our county. I worked 2 days to shore up our county chairman in each one, to shore them up, to make sure that they all stay home, so to speak, because we don't want to splinter them off. And then we're going to end up tied to another county. Or tied to another region. We're likely going to be tied to perhaps central New York. And, you know, we have a little bit more control of our own destiny in the North Country Regional Economic Development Group, which Kylie is very familiar with, because Kylie does a lot of great work for, what committee are you in charge of, Kylie?
I am the lead on the placemaking work group. So thanks for that shout out. I appreciate that.
Yep. So that's where we'll go. And then all this is going to be testing. There's going to be a lot more testing coming in, and testing requirements. And again, a lot of this is just roughed out parameters right now, but so we assume we're going to have the testing with the, with obviously the current cases, the current, um, positives or people with symptoms. There's going to be some broader based testing in terms of testing employees coming back in, perhaps. So that testing is going to be broadened. The antibody testing is probably going to be expanded, no doubt. And that is going to lead us to probably the next component of this thing, and that is really undefined and really kind of worrisome at this point. The fact that we potentially may have to hire 30 tracers, okay? And we're not completely, we're already doing that to a certain extent in our public. We have, like, that's why I started off early on. I start off by, when we have a positive, the first thing we do is what we refer to as their first cousins. Anybody that's had immediate contact with that positive, we reach straight out to them. And our success was, a lot of it was, we were in touch with them within 24 hours. Other counties, I've heard as long as 72 hours. That's a long time for somebody that's been in contact, immediate contact with a positive, to be roaming around out there, potentially spreading this virus. So, and keep in mind that just because our numbers are where they are, we flatten the curve, so to speak. We haven't, this is still an omnipresent virus. It is highly contagious. It is dangerous, and there is no medication for it as of yet, or vaccination. So we're operating against that backdrop. Our economic situation is operating against the backdrop that the healthcare crisis still looms out there and still has potential. So at best, what our objective is to move one forward and keep the other one steady. So that's, really in a nutshell what we're trying to do. So, so 30 tracers. Are they going to be county employees? Are they going to be a regional? Are they going to be a private sector? Somebody's got an initiative to get in the private sector, to figure out how to open a business with tracing. There's an opportunity out there. Excuse me. So that is yet defined. And do we have to repurpose employees in, before we're at 100% capacity, or, operations at the county? Do we have to repurpose some of our employees into tracing and train them? So we've got to get 30 tracers at some point up and running and trained, and figure out who's paying for them and all of that. So that is part of building this whole system. Isolation facilities, I assume, we had identified the college dormitory at GCCs as a possibility when we were moving into what was potentially the height of the situation, but that is not a long-term solution. So we don't know if an isolation facility has to be a long-term solution, has to be a short-term solution. Can it be a regional operation, or does it have to be a local operation? So again, that's one of these, it's a two-word bullet point that has a lot of implications behind it, and a lot of questions behind it, a lot of potential costs behind it, costs that we can't afford right now as a county, because we're just, we have inordinate cost right now to trying to deal with this current situation and have all of our other operations down and not running. So, in that regard, we're not producing much sales tax. We're not producing any departmental revenue, and our state aid, as you saw in the news yesterday, for the first checkpoint there, they're talking about a 50% reduction. That is 3 out of our 5 revenues are going to take a major impact, major hit. So isolation facilities, they're asking us to, spend money that we frankly don't have right now, and is going to position us. And while I'm talking about spending money, I will give a shout out. I believe he is on the finance chair for the county. Mike Montigelli is out there someplace. Hi, Mike. Hope you're safe. And thanks for all the good work that you do. So Mike's a great colleague, and I know he was signed up to be on today. So shout out to him. So then you got the reimagining part. You know, frankly, you know, I don't know how much we have to be participating in that to get. I'm more focused on getting what we have opened and not trying to. You know, I understand the component of think differently as we move forward, but you know, really, my position has been to the economic development agencies in the region. Kylie, you probably have heard me say this, and I'll say it one more time. Everybody that was closed by the government as part of this pandemic deserves the full and undivided attention of the government and of the economic development agencies until they open again. And we need all hands on deck. Put everything else aside, put all the other projects aside. We need all hands on deck to get our businesses back open that were closed because of an executive order, to get all of their employees back, okay, and operational. So that's what the economic development agencies are really charged with. You know that, and you're doing excellent work on that, Kylie, and I appreciate it very much. All your efforts that you've been putting forward to educate people and to connect them with all the assistance that's out there. You know, we have to, that's what we owe the people. We owe the public that right now. You know, their livelihoods, we have to be restored, and that is mission one right now. And so, you know, our promise to them is that if you do your part out there, if people do their part, and the economic development agencies put their focus and effort into the business community and get them back operational and get everybody back on their feet, we will work hard, and we'll give you 110% plus effort on the public health side to make sure that we continue to move forward. We continue to hit our 2-week intervals with success, and we continue to open this slowly, as it's going to be. The other item is the regional control room. Okay, we don't know what that means. That is one of those, you know, big picture items that, you know, frankly has cost associated with it. What does it mean? What's it do? You know, it's a very large term in a potentially costly term that is going to be a requirement. So we've got to flesh out all that. But I would tell you that we have an excellent relationship with the governor and his staff and lieutenant governor. I've spoken with her a couple of times on the phone. So we have an excellent relationship with them. And, you know, we will do what they ask us to do. And we will also continue to push what we feel is best for our region here. You know, to try to get everybody back to as close to normal as possible. So I think with that,
Sure.
is that an overview?
That's quite the overview. Yeah, I'm sure you
Okay.
can continue with updating and whatnot for another hour. There's so many things that are constantly changing and
Correct.
coming online and all that. But thank you for that update. I really appreciate it. And I know those that are on the call do as well. We do have some questions that are coming in, Scott.
Sure.
Again, I'll read the questions out loud, and some things I'm sure Scott won't have the perfect answer because they're figuring that out right now. But we'll start out with our first question.
Can you hear my dog in the background?
We can. It's not a virtual meeting without a baby crying or dog barking.
Okay.
So
Alrighty.
something we're all getting used to.
Okay.
Some of us, particularly tourism-based attractions, have unique situations that do not fall within the broader categories put forth by the governor. primarily those with significant outdoor facilities with space to spread out people. What's the best way to plead our case to the regional councils?
Well, that's it's a good question. I would say probably most of you have heard or know of Ron Thompson. So Uncle Sam's Boat Tours, and he sent me a very long message yesterday. We're in back and forth. We're texting, and he's going to submit a plan that is going to deal with the attractive nuisances. So in terms of marketing to people within the region, within the North Country Economic Development region. So just submit it in writing, detail it, and what you got, and ourselves along with the ESD. We'll take a look at it and see how we can fit it in and what phase we can fit it in, and see what appeal we have to make to the governor's staff to say, this has to be included in there. So I would tell you before we take another question is that all the businesses, the first things you can be doing right now is start drawing up your plans to make yourself possibly CDC guidelines out there in terms of what you can do to prepare your businesses for what the new environment is out there. And that includes, and that's what we're going to do at the county. It is going to include our public access points and what we're going to do there. And it is going to include if you have office settings, maybe how you have to space out people more. It's hygiene stations, no touch, hand sanitizer stations, washing stations. So all of those things, they'll be critical because that'll be a component of businesses opening. I think they're going to have to identify and maybe a plan to open. And our hope, at least it's my hope, that we can just do a simple one-page checklist and say, you've met that criteria, and we'll just have you submit it, and we'll file it and say, good to go. But okay, go ahead.
Right, great. Thanks for that. And I agree, following some of those CDC recommendations is a great starting point. At the Chamber of Commerce, we're working on gathering information that we'll share on our website for folks to start looking at ways to begin the planning. We're talking with public health as well to make sure we're all being smart about it. Releasing information that is, at this point, it's guidance. It's not put down as total regulation. But we'll continue to share information and get that website updated. So on to our next question. Say we do open in some capacity on May 15th. If local cases spike up again, will we have to shut down?
Yes. Yeah. If we do not meet the healthcare matrix that's going to be set up for us, established, if we don't hit those, if we don't keep within those guidelines, yes, we will be either potentially shut down or possibly even draw back. So that's what when I said, we're going to give you 110% effort. If we can get the economy going, we'll give you 110% or more effort, and that's our promise to you, is that our health departments are going to be working hard and that's why they really are out of their norm, our health department, because they work on the I-81 corridor, but they're reaching out to all the regional economic development council, and they're having their first meeting on Friday. And we're going to look at best practices and what's going to make them, each one of them, most successful, because their success is our success. And we're going to talk about data reporting that we're going to need from them, and try to get them on the same page so we can make those 2-week intervals. Yes, but we're definitely tied to a healthcare metrics.
Okay. So our next question comes from a nonprofit organization, and I would say this one is very much in line with the Chamber of Commerce as well. We rely on events as fundraising opportunities for our organizations to provide services. What do you see being used as a barometer, and when we can start kind of hosting those events again, and what would your estimate be of when that might happen? I know a lot of people have talked about the New York State Fair being the indicator, but have you heard of anything else on when that is going to be available to do?
No, there's no clear guidance on that, but I would tell you, when I tell you we hope to be by fall, it would be great if we were at 75%. That remaining 25% would be the gatherings, right? These gatherings, and they're off the table for the time being. So, even if we could implement any of those by the end of the year, that's when we're going to get closer to 100%, when you start seeing some of these gatherings come back. But right now they're done for the foreseeable future. And so, we can appreciate that, but we're just gonna have to learn to live without those for a while. So that's gonna be the last 25% probably.
Sure, absolutely. And I think now is the time to start researching some virtual opportunities for fundraising for nonprofits. Obviously, we don't want to lose their critical services across the region. So there are a lot of opportunities that are being shared out there for fundraising techniques that can be done virtually. So I think now is a great time to start looking into that.
Mm-hmm. Yes.
Next, we have a question regarding the control room. Is it a possibility to have our emergency management serve as the control room, or can the hospital serve in some capacity as an isolation unit?
All good questions. That's what we have to flush out. So there's precisely some of the questions that we have. The hospital would probably no. I would tell you at the outset, probably no for the hospital facility, because these are the people that are, so they don't have the acuity to go into a hospital necessarily, but they may be positives, or have to be quarantined because they're in close contact to a positive, whatever that might mean. But they won't have the acuity level to go into a healthcare system, so thered be no DRG for the healthcare to get paid. To have these people. So no, I think St. Lawrence County was referenced a former, and the United Helpers, one of the empty United Helpers buildings up there. So, could it be regional? That's probably the best approach. So, but I doubt it would be a hospital. It would have to be a separate facility. And the regional control room, we have no idea what that is yet. I'll be honest with you. So it could be our EOC. It could be that, but
sure.
Yep.
I appreciate your honesty. If you don't know, and we've got to figure that out. I think
right.
to...
Can I touch base about masks if people are open, because we get inundated those. So I'm compliance. I'm in charge of the compliance of the New York Pause. So I get the real-time complaints. So if you try to open before ahead of time, it comes into my email. It goes also to our county attorney, and you'll likely get a letter from our county attorney and our codes to say, hold on, we have to remain in the order of the day, unfortunately, whether you like it or not. I'm not here to debate that. I'm just here to tell you that's what it is. And we have to abide by the rules right now. So we get a tremendous amount of questions and complaints on face masks. So let me tell you the guidelines here. Okay, so the face masks are mandated if you can't social distance. Okay, big old caveat there, right? It means you have to wear them, but you don't. So it is your choice to allow people into your store without face masks, just like it is if you have a shirt and shoes policy, okay, and you're running a customer access store. It is your choice to let people in without a shirt. It's what choice to let them in without a mask. You can't mandate, you can't make them work, wear a mask coming into your store, but you can deny them entry to your store. So like you can if they don't have a shirt on or shoes on. So think of it like that: shirt, shoes, and masks. You should all change your signs on your stores or offices or whatever. You're required to wear shirt, shoes, and masks. So that's it.
Thanks for that. Yeah, I know
Yep.
there's been a lot of questions on if they absolutely have to wear that or, you know,
Mhm.
it can force them to wear that. So thank you. Just some clarification. Is it the regional council that will be in charge or the 7 county legislator chairs? You have referenced both, and I just want to make sure there's a question if you could just clarify which that will be.
Probably the regional councils may play a role in the fact that the ESD is tied to the regional councils, and that is the regional council, right? And so, but it'll probably be largely engineered by the counties. So we're going by economic development region. That's just how the opening is being defined. I don't know if there's going to be a direct role played by the regional council board members, which Kylie serves on, and I'm ex officio on. So I don't know if we'll have an actual role in that. I suspect he's just going by the regions because that's the way it is already. Got 10 regions out there, so we'll take the openings by those 10 regions. So that's kind of this way of identifying who's going to open and who's included in what openings, because he believes, and rightfully so, when we offered to go first, is pointed out, and he pointed it out back in this news conference the second day, that if you open, all you're going to do is invite everybody around you to come to your area, which isn't a bad thing. But you have the potential to the question of the maps that's always out there. Why didn't you produce a map? Is you start bringing infected people into the area, and there's a lot more movement, and with movement creates more potential problems. Yep.
Sure. Kind of going along similar question as kind of who will be facilitating, but what body or contact specifically would businesses submit their plans to? Are we at that point yet, or is that determined?
No, we're not at that point yet. And we won't be at that point until we get a presumed person in charge of the region. When we get somebody in charge of the region, like the Western New York and Finger Lakes area, we will get to that point. And I assume that will all come into this control room operation. All the reporting from the public health will report into this control room. The healthcare facilities will report into this control room. The businesses will file their plans within this control room, and the people that are whoever's operating out of that, I don't know yet, but
Sure.
So yeah.
Scott, can you share your contact information in case anyone has follow-up questions or would like to be able to get a hold of you?
Sure, happy to. I have to look it up. I think it's Scott G at co.jefferson.ny.us.
So Scott G at co.jefferson.ny.us.
Correct. That's my county email. Yep.
Okay.
My phone number. I don't have a problem with my phone number. People, they can call me through the office. I'm there at the county daily, so in and out a lot of times. But I'll give you a couple of numbers. The county office number, the main number is 315-785-3075. And my cell number is 315-778-6214. And that's for anybody but TJ Penn, who's probably on this.
He is.
TJ's on there. Can you mute him permanently?
Yeah. What's your cell phone number again, Scott? I'm just adding it to the chat feature so everyone can jot that down.
Yep, it's 315-778-6214. And Kylie, I'll dearly pay you a lot extra if you can figure out a way to mute TJ Penn for good.
If you want to give us any money, that would be great.
What's that?
If you want
Okay,
us any money, that'd be great. I'll do
sure.
what I can. All right, we do have time for one more question. Let's see, we have someone, have we engaged our rural health networks in the processes that are taking place?
We haven't yet. We haven't yet, and that is a good question. I will put that to Ginger Hall and have her discuss that on tomorrow's 10 o'clock Zoom meeting with the public health departments through the region. So I will tell you, Faith Lustick from our health educator from our public health department took the initiative to reach out to the other counties and say, hey, whether we're combined by DOH or not, there's Faith, you got it, Eileen, she's perfect. She reached out to all the public health departments in the area to schedule the meeting that's tomorrow that's going on with the public health directors, and health educators are also meeting next week. So she's done just fantastic work. So
excellent. It's good to know that we're working together kind of regionally to start opening up. I think it makes a lot of sense to do that. One quick thing before I ask for any final thoughts, but this is probably on a lot of people's minds, and I know we're expecting some answer this week, but is there anything you can share about schools opening?
Schools opening this year? Well, I can't give you any specific insight, but if I doubt you'll see them at this point. It's going to be May. We're only talking 2 months. It's going to be probably pointless, I would guess, to, before we even get into our next phase, which will be middle of May, middle of May before we get to our first phase. So before we even get to our second phase, it'll be the end of May. What do you got left? 3 weeks of school? They're not going to try to, so you can reach the conclusion on your own, but I doubt you'll see them try to ramp up the schools for only a 3 week period. I think you'll see them take a deep dive into school settings and start to, you may see some experimenting, you may see some expansion of the summer school programs and things like that. And but I think they remain closed. I think they take a deep dive into both teleeducation and the actual settings in the buildings, and they work towards a fall opening, which would be tremendous. I mean, colleges would be ecstatic, and probably schools would be ecstatic if they get open in the fall. So, sure, if all goes well.
Okay. Well, do you have any last thoughts before we close up for the day?
No, I mean, I just appreciate everybody's time. We have, we have a lot of work, and there's a lot of spokes that are going to be, moving this whole economic reopen forward. There's a lot of spokes out there, and everybody's going to have to do their part. Everybody's just be patient, please. We are working. It's our hope that we'll meet at the metrics on every 2 week interval, and then we continue to open up. We continue that progress. I think if you have the idea that our public health department is working hard for you folks, and the county is working hard for you folks to making sure that you're going to get your livelihoods back. And there is no, let me just address this, wherever this notion comes of letting anybody go bankrupt. It's not in anybody's best interest, okay? And I know who said that, but it's not in anybody's best interest for anybody to fail, period, okay? And it is, you can't have an economic reopening when government is crumbling around you, nor can government reopen when the economy is crumbling around us. So we all have to move together. We have to have a good economy. You have to have a strong government, and you have to have a responsible government. It'll be tough. We have tough decisions to make. That's down the road. We know what our impacts are. There are multi-millions dollar impacts here going on. But it's not in anybody's, as a county, we don't want to see town and village governments falter. And also as a county, we don't want to see state governments falter. So, the notion of anybody faltering under this scenario is a faulty notion. And, we just have to be, everybody's success is tied to each other. So, the success of local government in getting you folks open is and you folks operating at full capacity as quickly as possible is tied to our success. So, so we're partners in this. We will give you a full effort.
Great. Thanks so much, Scott, for joining us today. Again, this was a coffee talk with the Greater Watertown North Country Chamber of Commerce, and we just heard from Scott Ray, Chairman of the Jefferson County Board of Legislators. I hope everyone has a great day. Stay tuned for further coffee talks, and we'll continue to educate our business community as best we can during these challenging times. And thanks so much for everyone's patience as we're all working together during this difficult time.